Good evening. Today we are speaking with UMHS 2019 graduate, Dr. Valeria Fomitcheva. And Dr. Valeria Fomitcheva, welcome. And we're here today because you completed an internal medicine residency at Sinai in Baltimore. What about your residency? What was your residency experience there like?
Hi, Scott. Thanks for having me. I have to say that I think anyone who did residency from 2019 to 2022 is going to say that it was a different experience because of
Right.
COVID.
Of course.
But my general overall comment for anyone going into residency and applying and doing their ranking list, by the way, congratulations on everyone that matched this year at our school. The recommendation is going to be the experience and the residency is what you make of it. So I think by the time that I got into residency, I was happy to finally be doing, clinical work and getting paid. So I enjoyed my residency experience. It was tough. It was hard, just like most of the, different stages that you go through in medical school. But overall, it was pretty good.
Okay, great. And you are now presently working in private practice as a primary care attending. And can you just fill us in a little bit on, and maybe for some of our current or prospective students that aren't aware, what are some of the things that a primary care attending does, in private practice, and what are some of the most rewarding things about what you're doing right now?
So generally, the idea is primary care attending, internal medicine trained. You build a patient base that you regularly follow for preventative medicine. The most rewarding part for me is building long-term relationships.
Right.
When patients come to me and say, "This is my doctor," they know me by name. You kind of get to have more of a personal relationship with patients. Sometimes you're treating several generations. It can be grandparents, patients, and their children once they get to the age of 18. And then the most rewarding thing I think that I hear on a regular basis is when people say, "Wow, thank you for explaining that." The primary care setting actually allows you a little bit more time to, delve into why do we need to take statins? Why do we need to take blood pressure medication? Why is it important? So I like to provide education for my patients, and my patients really appreciate that.
Wow, it sounds like you do a really good job explaining things. That's so important in primary care. And finally, can you tell me like one or two things that you like the most about being a Canadian studying medicine abroad at UMHS, and also one way that UMHS helped you become the doctor that you are today?
Specifically for UMHS, the reason why I chose that school was the small classroom size.
Right.
I don't know if you know many other Caribbean medical schools. The Bio 101 class, there's like 700 students in certain
Of course, yeah.
universities. So I didn't want that. I've been in classrooms that are large and you're just a number. And I felt like my medical experience needed to be different than my undergraduate experience. Being a Canadian in studying abroad or going to medical school, I feel like I actually was well prepared because of my undergraduate background. I think we have very strong schools and universities in Canada. So I think that a lot of the times I found that I had an upper hand because university is tough in Canada. At least personally, that's what I found. So, and yeah, I think mostly it was the fact that I got a very solid foundation in basic sciences on the island before I started doing clinical rotations, which are still carrying me through to this day in my practice.
Wow, that's amazing. Also, do you have any just general advice for Canadians that are considering attending UMHS? Maybe they saw something about an upcoming, information seminar or something, and they're a little hesitant. What would you say to people like that?
So So I think I have probably three things I would say.
Okay.
Be prepared to move a lot. So the first, 4 or 5 semesters, depending on how long your clinical or your basic sciences are, you'll be in one place, which is great. It's great to have a very stable weather that you can study in all the time. And then, as a Canadian, I think it's important to make sure that you can secure finances. I know that loans and things like that can be difficult for Canadians. And so it's important to make sure that you plan ahead financially. And then the last thing is don't give up. Hard work always pays off. So just keep going.
Great. And I know that you had a really amazing, I think you worked with Geneviève as your
Yeah.
admissions counselor. Awesome. And what was it like working with her whenever you were
So
applying?
she's Geneviève is actually amazing. So we're from the same city, and I had a lot of hesitancy about moving to the Caribbean, starting a
Sure.
Caribbean school. So when I met her, she met me in person. She lives in Gatineau, on the Quebec side. I lived in Ottawa at the time. We met in person for a coffee. She's very approachable. She's very, very knowledgeable. She used to work for the admissions office in one of the medical schools in Canada. And so she's very knowledgeable of the process of applying to medical schools and how difficult it can be, and some of the barriers that we experience. So having a contact who is from Canada and kind of answered all of my questions was probably also the reason why I chose UMHS over other schools that didn't have a Canadian representative.
Wow, so that's amazing. So you had some really good guidance. I know Jen's really a great counselor. Anything else that you'd like to say about Canadians considering med school in the Caribbean, specifically UMHS?
I think, I think if you feel like you're ready to just go for it. It doesn't matter if you do medical school in Canada or the US, it's going to be hard regardless. But if you keep working, you'll get through it. You just got to keep doing it, keep trying, and hard work always pays off.
Great, excellent. All right, well, Dr. Fomitcheva, I want to thank you so much for your time this evening, and I wish you the best of luck and everything. Thanks for speaking with us.
Thank you. I appreciate
All
it.
right.